Great, so thank you very much for this opportunity to talk to you and to participate in this fantastic meeting. I've been really struck by the diversity of different perspectives and approaches, and I think only by talking to each other can we hope to move forward with this work. So, now, I think more than ever, we're actually aware that events and phenomena that occur at a global level are having an impact on health at the local level here in the UK. And I feel that we need to have health professionals that are adequately equipped with the skills that are necessary to actually address these challenges. And we've heard a lot about many of these forces today, things such as conflict, political changes, global warming, pollution, financial inequalities, and migration. So I'm here to talk about the work of the Global Health Curriculum Group, which was established in 2010, and it's had a number of different incarnations, different names since that time. But essentially it's a group of doctors in training from different specialties, focusing on the curriculum changes that we need to actually function in a globalised world. So focusing on what the average doctor or indeed health professional working in the UK needs to know in order to practice in the globalised world. So an initial piece of work was conducted looking at the postgraduate specialty curricula, and out of the 11 that were examined, only 6 of those actually referenced global health in specific competencies. However, all of them were identified as having competencies to which global health was relevant. So, following on from this, the Academy of Medical Royal Colleges, which is an umbrella organisation that brings together all of the medical royal colleges for the different specialties to discuss issues that affect doctors across the specialty spectrum. They had an international forum which commissioned the Global Health Curriculum Group to actually produce a piece of work that looked at what would be the curriculum framework necessary for global health. And the piece of work that was conducted as a result of that was a modified Delphi study. So this is a formal process for gaining consensus. It had 3 stages and involved an online questionnaire, in-depth interviews, and then a 3rd round where responses were invited from all of the participants. And it involved all the stakeholders, from patients, health service leaders, professionals, educators, and trainees. And the result was published in International Health, the journals of RSTMH, and we've also developed a 2-page summary document which is on the Academy of Medical Royal College's website, which is a little bit more accessible. And the competencies that we developed are these 5 broad capabilities, and rather than being designed to be adopted whole scale into a curriculum, this is to be seen really as a lens through which to view other capabilities or competencies. And all of these 5 core capabilities are interconnected and of equal importance. And they address topics and issues that are relevant to all clinicians, regardless of the place of work or their professional background. So the first one is diversity and human rights and ethics, which is about a person-centred approach to care, taking into account patients' beliefs, preferences, values, and their rights. The environmental, social, and economic determinants of health is about promoting an understanding of the influence of these various factors on health. Global epidemiology focuses on the awareness of patterns of both communicable and also crucially non-communicable diseases and how they vary geographically. global health governance considers national and international policy frameworks and also guidelines that affect care delivery and research. And finally, health systems and health professionals urges clinicians to understand their own health system and how it relates to others worldwide, and also with special attention thinking about workforce issues and professional staffing. And we've seen that global health has been gaining traction in the UK, and this is an extract from the generic professional capabilities, which is a document published last year by the General Medical Council, which is the regulator for doctors in the UK, actually specifically referring for the first time to a need for doctors to understand global health and the principles underlying it. So, since we published the framework, we've been looking at how we can get the word out there and how we can actually implement it. We had an event in September of last year at the Royal Society of Medicine in partnership with their global health group called Global Health in Local Practice, which is really focusing on what we feel is important, so for all health professionals to actually implement this in their own local practice. And we had 150 attendees, which was fantastic. But I think the problem with that is that you are potentially just preaching to the choir, and it's about getting the word out there to those people who may be, in fact, turned off by seeing the word global health. We also had a round table with the all-party parliamentary group for global health, bringing together key top-level stakeholders to actually consider this: MPs, peers, universities, and professional groups. So this session is about challenges and opportunities. Unfortunately, we have had plenty of challenges. So I think there's really a variable interest between individuals and between specialties and professional groups. So for instance, some Royal Colleges have really enthusiastically taken up this idea and run with it, whereas others have been much more resistant. I won't name any names. Also, I think it's worth thinking that there's considerable variation in training pathways, particularly for postgraduate health professionals. So just within medicine, between different specialties, there's huge variation, but then that variation becomes even greater when you look at other professional groups. I think one of the key things that came out of the roundtable of the APPG was about the need to develop support structures. So it's all very well putting it into the curriculum, but how do you actually deliver it? How do you train the trainers, particularly if they don't have any familiarity with these concepts? And then I think one thing we've come across is that there are many competing demands for the curriculum. So there are a whole host of things that people want to put in, not just global health capabilities. And how do you prioritise global health within that framework? Someone's described a curriculum as a bit like an oil tanker, in that turning it in any direction other than the one that it's already in takes quite considerable time and effort. However, there are lots of opportunities. As you can see, there is support from many senior policymakers and also the regulators, the GMC, the APPG and the Academy. I haven't mentioned the role of Health Education England, which has a new Global Health Exchange group, which is looking at the impact of volunteering overseas on the NHS and the health system in the UK, which is really exciting. Also, as part of that, there's the use of overseas placements as a recruitment strategy. So seeing that time spent overseas is not only useful, but it's also appealing and can bring people into specialties that are struggling to recruit. And finally, I think it's important to focus on how you can actually develop practical learning resources and opportunities for people to actually develop those skills in global health. So thank you very much for your attention.